Everybody, and welcome to the AGM of the West Yorkshire Integrated Care Board. I'm Nader Mirza, and I'm your acting chair of the West Yorkshire ICB. Just to let you know that this meeting is held in public. It's not a public meeting, but there is an opportunity shortly for public questions on items on the agenda. So please make sure, Actually, this isn't a public meeting. This is a meeting that's held in public. There aren't any questions from the AGM, but at the public session afterwards, there will be some questions there. So I'll maybe just get my papers correct here. Okay, yes, I have. Thank you. Can I urge you not to take any photographs, just in terms of confidentiality and privacy of those people here. We are live streaming, as I said, and we'll share any photos via our social media should you wish to view these. And we ensure that the necessary consents are in place to do this. What I will start off with is an introduction of the board members around the table. Myself, Nader Mirza, and then on my left I have...
Hello everybody, my name's Rob, I'm the Chief Executive of the Integrated Care Board.
Hi everyone, my name's Ian Holmes, I'm Director of Strategy and Partnerships and Deputy Chief Executive for the Integrated Care Board.
Hi, I'm Jonathan Webb, Director of Finance and Deputy Chief Executive.
Afternoon, I'm Ranju Chatterjee, Non-Exec Member for the Board.
Good afternoon, I'm Beverly Geary, I'm Director of Nursing for West Yorkshire ICB.
Hello, I'm Richard Vautry. I'm the member for Primary Medical Services.
Hello everybody, I'm Kim Shuttler. I'm the sector lead for the voluntary community and social enterprise sector.
Hello, I'm Robin Tuddenham. I'm executive lead for Calderdale and chief exec of Calderdale Council.
Hello, I'm Victoria Eaton. I am the Director of Public Health for Leeds and the partner member of the board on behalf of all 5 Directors of Public Health in West Yorkshire.
Hello, my name's Tim Riley. I'm Accountable Officer for the ICB for the City of Leeds.
Hi, I'm Hannah Davis. I'm from Health Watch Leeds and I'm here on behalf of the 6 local Health Watch working across West Yorkshire.
Hi everyone, I'm Jane Madeley. I'm a non-exec member of the board and chair of the audit committee.
Hello, I'm Anthony Keeley. I'm the director for the ICB Organisational Change Programme.
Hello everyone, my name's Fatima Khan Shah and I am the West Yorkshire Inclusivity Champion, which is a role that is shared between local government and the Health and Care Partnership.
Hi everyone, I'm Karen Jackson. I'm the sector lead for community services and the chief exec at Locala.
Good afternoon everybody, I'm Councillor Tim Swift. I'm a councillor in Calderdale. I chair the West Yorkshire Health and Care Integrated Care Partnership.
Good afternoon everyone, I'm Deborah Taylor-Tate and I'm here deputising for Lou Allgood, Interim Director of Planning and Performance.
Hello everyone, I'm Shaukat Ali Khan, I'm the Chief Digital and Information Officer for the ICB, West Yorkshire ICB.
Afternoon, Therese Patton, Chief Executive of Bradford District Care Trust and Place Lead for Bradford District Craven Place.
Good afternoon, my name's Dr James Thomas. I'm the Medical Director at the West Yorkshire Integrated Care Board.
Afternoon, Vicky Dutchburn, the Interim Accountable Officer for Kirklees Place.
Hi, Ed Whiting, Chief Executive, Leeds City Council, here for the other local authorities.
Hi everyone, I'm Kate Sims, Director of People at the ICB.
Good afternoon everyone, Majid Hussain, non-exec member.
Hi, Amy Willett, Head of Corporate Governance for the ICB.
Hello, my name is Laura Ellis, I'm the ICB's Director of Corporate Affairs. So a very warm welcome to you all, especially the members of the public, and a warm welcome to people who will be watching on the live stream. We have apologies from Lou Auger and Deborah Taylor-Tate will be deputising for her. Our first item is a declaration of interest. We have a register of interests of board members. These can be found on the website, and those in attendance are also asked to declare any specific interests presenting an actual or potential conflict of interest arising from matters under discussion of today's meeting. Okay. We'll go to the minutes of the previous meeting that were held last year. This is my first year as acting chair and first year at the AGM as a member of the ICB board as well. So we want to approve the minutes of the meeting in 2024. Can I take these as an accurate record? Okay, yes. No matters arising, Laura? No? Thank you. Okay, so we're going to go into the proper body of our meeting now. You'll hear in a minute information about our annual report and our accounts. You'll also hear from our Chief Executive Officer, Rob Webster, about the sort of year we've had, some of the challenges that we've been facing, and some of the opportunities we now have as an ICB board. And I think as a fairly newcomer to the board, I'm so impressed by the partnership that we have and the fact that we work collectively together and demonstrate to the rest of the country how we can work differently and well in our system in West Yorkshire. And a lot of that is thanks to our patients, members of the public, and of course our staff colleagues, and to partners sitting around this board here. Before we go into hearing about the reports and the accounts, earlier today we had a private meeting and we raised the topic of some of the difficulties and issues that we're facing in the country and locally in terms of some of our communities feeling discriminated against, experiencing racist, Islamophobic, homophobic, and other pieces of discrimination. And we as an ICB take a very strong stand against this. And I'd just like Rob to say a few more words.
Thank you, Nadra. I think we've got a really strong partnership, as people can see from around the table. We're a partnership that's built on the NHS, the third sector, our councils and our communities coming together in a shared endeavour, which is to improve outcomes for local people. And those outcomes show some fairly shocking variations in them. And as part of that, we've got a really strong endeavour to focus on all of our communities. All of our communities everywhere in West Yorkshire, from birth to death, from head to toe, inside and out. We support people so that people can live fuller lives, that they can fulfil their potential and that outcomes improve, and that those outcomes improve for everybody. What we also have is about 100,000 people working across the health and care system, and we have a very representative set of staff from the very diverse communities that we have in West Yorkshire. And it's pretty clear from the conversations that we're having with our staff and our communities, there's quite a lot of tension, quite a lot of unhappiness and some distress from some people. And the descriptions of how they are feeling at the moment are fairly harrowing and distressing and upsetting. And we are the first system of sanctuary in this country. We are an anti-racist system where people and organisations across the whole of West Yorkshire have come together to say, look, there are things that we can do to make sure that we have a more equitable society, and structural inequities are not part of the system. That takes time, effort and energy. And we know that there are some people who feel overlooked and disenfranchised too. But there's no excuse for racist, Islamophobic or homophobic activities in our organisations or in our communities. And I think we want to make sure that we work with our communities to find a way forward and ensure that people always receive good care that's tailored to their needs, that's culturally competent and appropriate, and which helps us to improve everything about what it's like to live here, a rich, diverse, and I think brilliant place to live. So I think we just want to reaffirm our commitment to, equity and equitable access to services, improving outcomes for everybody, being an anti-racist system, and being a system of sanctuary.
Thank you. Thank you, Rob. We'll now go into receiving and hearing our annual report and accounts, and it's Rob's to start off with, and then we'll have Jonathan Webb, our Director of Finance, and then Bev Geary, who's our Chief Nurse, and James Thomas, who's our Chief Medical Officer. So it's Rob first.
Thanks, Nadra. So thank everybody. It's absolutely brilliant to see everybody around the table, as ever. And as I've just talked about in my opening remarks, and you can see from the introductions, we do have a really good representation from right across our system. And this partnership of councils, the NHS, third sector and communities is represented around this table. And we have a big board, because we want to make sure that every partner has a voice. That includes the public, our councils, the third sector, and the NHS, on all elements of the NHS. So we've got provider collaboratives here on acute services, mental health, community, got each of the 5 places, got Health Watch, etc. Now, that sense of partnership, it takes us through a period of, transition in health and care. We're still in a position where we're recovering some of the national standards because of the impact of COVID. We're looking at how we ensure that there's really strong connections in each of our places between all of the partners so that we can deliver those improved outcomes. And we're wrestling with, some significant distress in the public finances. We still do, though, spend £7 billion a year together. And as I've said, there's about 100,000 people who are employed across the health and care system and the partners represented around this table. So we have a lot of investment and a lot of impact that we can make. Now, in doing that, we always focus on 4 things. I just wanted to reinforce this in the context of the current changes that are going on in the English NHS across the country. We are here to help improve outcomes and reduce health inequalities. We are here to make sure that those unwarranted variations in care are addressed. We are here to make sure we use public resources wisely. And we are here to deliver the biggest financial, economic and social impact that we can with the money that we spend. And we talk about those things. Our board assurance framework is driven by those things, and our strategies are all driven by those things. And in doing that, you can see we're a true partnership that values evidence and a principle of subsidiarity. So most things get done by somebody themselves. We sometimes work with them in their house, sometimes in their neighbourhood, sometimes in the place they live, and sometimes across a West Yorkshire level. And that sense of bottom-upness, that sense of facilitation drives what we do. And as leaders, we believe in sharing risk, sharing power, giving other people authority to act whilst retaining accountability ourselves. And today is part of that accountability. So publicly, live streamed, recorded forever, we're saying, what have we done with the public's money and what difference are we making together? Now, if you look at the things which are often part of the government's agenda, and also through Health Watch, we've done work which says, what do people want? And guess what? They want the same things. They want to be able to get their operation sooner, get an ambulance to turn up if they call 999, get to see a local GP, get access to a dentist, make sure that A&E is open and accessible, etc. So across the year in 2024-25, we set out some significant plans to improve the position on some of those areas of performance in our system, and we should make no bones about it. If you want to address some of the performance issues in the system, there's a system response to that. So the ambulance service, you probably can't see, maybe the slides are a bit, there might be a bit of light on those. The ambulance service is recovering back to national standards, and the thing we're asked to do is to look at category 2 ambulance response times. This is where people might have had a heart attack or have a condition that requires an urgent response. And the target was to get to an average of about 30 minutes from the ambulance being called, from being on scene and making sure people were being supported and transferred. That response time was about 28 minutes. So we managed to exceed the target. Now, that wasn't just by the ambulance service working on its own. That was by working with hospitals to look at what happens at the interface. So we reduced the number of ambulances queuing outside. That therefore requires us to think about, is the A&E clear? If the A&E is clear, that means people have to be going into the hospital and they have to be going out the other side. So what you can see across the board is that on our A&E performance, we were close to, we improved the position, but didn't quite get there in terms of the 78% target. We're at 77.3%. We exceeded the standards that were set on ambulance response times. Our bed occupancy reduced, which is a good thing. Still at 94%-ish, which is not particularly where you want it to be in optimal use of hospitals, but better than it had been. Exceeding our cancer faster diagnosis standards, exceeding the targets on 62-day standards for cancer with an improving position. Fewer people waiting for diagnostic tests, but double the rate that we want it to be on an improving trajectory. So 5% was the target, 10% was where we got to, but from a baseline of 16. Significant numbers of additional GP appointments. Again, general practice continues to be the most productive part of the NHS, where a significant number of people, about half, are seen on the day, and more than 7 in 10 are seen face-to-face. The demand, though, for general practice outstrips some of the supply, and we know that people tell us they don't always get the care that they need when they want it, so there's still work to do there. In terms of talking therapies, again, above the target that we set. The number of children and young people with at least one contact in NHS-funded mental health support up, but not quite where we want it to be in terms of the position overall. So up against the target, but down on the previous outturn. So still some work to do on young people's mental health, and then still some work to clear the very long waiters, but still progress. So if you look at the national standards, some significant progress towards recovering where we really should be, which is achieving the 18-week standard, the 4-hour wait in A&E being at 95%, and so on. And that is a medium-term game. That is a medium-term game. Now, that's not the only thing that we do, though, is it? We don't only focus on those access targets, although these are things that the public want. We have to focus on other things that are important to us, like access to dentistry, for example, like improving outcomes for people with a learning disability, and so on. And I just wanted to talk through a couple of those examples. So suicide is one of the biggest killers in West Yorkshire, one of the biggest killers nationally, and continues to be a significant issue, particularly for young males. And we have a programme of work which is attempting to reduce the suicide rate and the number of suicides in West Yorkshire, which are closely correlated with the state of the economy and require a whole system, a whole partnership approach. Now, all of these stories are really exemplified by people, because we're a people business, and the way that we work with people, the way we support people, the way people can support us is fundamental to what we do. Now, if you look at, you might have met these two people before, Charlotte and Dave, and Charlotte survived a suicide attempt because a driver stopped to talk to her at the train station, and the stranger, Dave, later became her husband, and they inspired a song by, if you're a folk fan, Kate Rusby, you might know the singer. She wrote a song about them, and it became a kind of national news story. And what Dave and Charlotte wanted to do was tell the story, because they want other people to be aware that the biggest driver of suicide is a loss of hope and a feeling of helplessness. But there's always hope and there's always help. And we have a suicide prevention programme. We have substantial assets and resources available online and in person. We're the first ICB in England to introduce mandatory suicide prevention training for our staff. And we've made all of the free Zero Suicide Alliance training available, and we promote it as much as we can. About 1,500 people have been through our mandatory training, with 96-97% of people saying that was really good and that taught me something new. If you want to access some of the resources that we have Check In With Your Mate and Check In With Pride campaigns, which can help. Now, alongside issues such as suicide, we know that you can become more healthy and resilient if you have a job. And we have some of the best independent placement services, individual placement services in the country when it comes to trying to get people into secure employment. And these processes have been given a massive boost in the last year because we're fortunate, alongside our combined authority colleagues, to be part of healthy working life programmes with a trailblazer and accelerator sites for keeping people in work, building on what's good, and getting people back into work. And 100,000 people in West Yorkshire are out of work because of some long-term condition or health issue, and we can support them because a significant portion of them want to work. And if we give them tailored support, that they can work. And somebody like Mady here, who received individual placement support back into work, despite having a history of trauma driven by his former refugee status, managed to overcome mental health anxiety issues and depression to rebuild his life. And that's where we've got to. So things are moving forward because of that, which makes access to health services less reliant and positive contributions to other people and society more prevalent. If you look at how we ensure that people find their long-term conditions, many of us sitting in this room, many of you watching online will have a long-term condition. Many of you won't know it because you've got cardiovascular disease or lung cancer or something else and haven't had a health check or haven't had a targeted health check. So we have a Find Out How You Are campaign, really. Find out how you really are. We're dropping sessions in multiple locations where people go. Rather than asking people to come to us, we go to them and provide services elsewhere. And that's allowed us to reach about 500,000 people, with 39,000 of those face-to-face, the rest online. And we've seen Steve, for example, a lifelong rugby fan, with extremely dangerously high blood pressure during a health check, go into active treatment. And he wanted to tell everybody about how he thinks that's probably saved his life. So we know that there are a number of people who could benefit from prevention services if they accessed care differently. So we're changing the way that we access services. Now, dentistry is never far from the news. And in 2024-25, the responsibility for commissioning dental services passed on from NHS England to the Integrated Care Board. And we decided as a board to invest in staff to coordinate that and money to pay for it. It may have even been the previous year. But what we've seen is a substantial increase in the number of children and adults who access NHS dentistry, with an additional 59,000 urgent care appointments, nearly 2,000 new orthodontic starts. We did some targeted work with populations for whom dentistry genuinely will change their lives and potentially save their lives, such as the homeless. And we're now one of the parts of the country which has improved incredibly fast. I would be misleading you if I didn't say there was still a huge amount of way to go to get everybody covered in terms of the access to services. Now, we also recognise that there are people who support us in our system who sometimes are invisible. Working carers, informal carers, are a substantial part of everything that goes on in West Yorkshire. There are, at least 300,000 unpaid carers in West Yorkshire, and a substantial number of those are young carers. We've had a big programme of work to ensure that we've been able to spot young carers, make sure that they understand they're a carer, make sure that their GP, their school, their educational establishment knows that they're a carer, and give them the support that they need to flourish into the future. And we've been really proud of the work that we've co-produced with young carers to make sure that they feel that that's theirs and that is accessible to them and not designed by people who look like me and are a long way from being young. So those are just some small examples of some of the work that we do. I could talk about a whole range of other things that we've done, but we don't have time to. They're all in the annual report. And in amongst all of the stories that we hear about things that have gone wrong, and things do go wrong in the health service, in amongst all the stories about financial distress and pressure, we can't forget the difference that we're making and the fact we're on a general upward trajectory in terms of overall performance, and an unwavering commitment, I would say, to this kind of partnership improving outcomes for local people. As part of the future, and we'll talk about this a little bit, I'm sure, in the quality priorities, etc., there is a 10-year plan for the NHS that's just been published this year and will form the basis of our future plans. In terms of our voice in that and the public's voice in that, we held a huge number of engagement events and were able to put the voice of people in West Yorkshire into that process. And that 10-year plan talks about further improvements in outcomes, further focus on the whole place approach, the whole partnership approach to improving care, developing joined-up services in neighbourhoods, better access for people into providers who work collaboratively to join up care themselves, and a set of arrangements which will incentivise that through money and regulation. So really, I hope that's given you a flavour of some of the last year. It isn't the whole story, as I've said. And I'm going to pass on to Bev and James to talk about quality, effectiveness, safety and outcomes.
Before we go on to Bev and James, as Rob said, you can get the full annual report and full accounts for 24-25 online under West Yorkshire Health and Care Partnerships. The AGM is a very, very short amount of time giving you a quick overview. So if I ask Bev and James and then Jonathan just to give one highlight and one challenge and one opportunity, if possible, in their area of work.
Thanks for that, Nadra. So I'll throw my script out of the window. I just want to mention some of our quality priorities that are listed there. There's a lot of detail in the annual report, as has previously been mentioned. I think one of the things that I'd like to highlight is the work that we've done with care homes to standardise our approach across West Yorkshire in terms of ensuring quality and safety for residents within care homes, whether they are LA, local authority funded or the privately funded, and also the improvements that's been made about medicines management and safeguarding and access to some of those, and also the cross-sector work that we're looking at to include resident and carer voices. In terms of challenges, I think it's the change at national level, but I'm looking at this as an opportunity, to be honest. So we've got a national quality strategy that is in draft form. We will review our quality and safety priorities in line with that when it's published, so that we've got priorities into the next year.
Thanks, Chair. So there are so many things kind of I wanted to talk about and could talk about, but I've picked out vaccination as an area there, which I think actually gives us really, there's a positive stories there in terms of what we've been able to achieve, and vaccinations is all year round. I put on the slide about influenza, flu, and COVID-19 vaccination campaigns, which we've delivered over the last year, and as we enter this month in terms of starting the winter campaign for flu vaccination there for children and for pregnant ladies there. But as we go into October onwards through the winter, that we start to look at kind of the wider population for flu and cohorts for COVID-19. So I think there's massive opportunity there in terms of ensuring that we massive challenge there in terms of making sure our services really go out into our communities so that they're accessible to our communities. I think the opportunity really is about how we work with our communities, and I think Rob's talked about integrated neighbourhood teams there. We've got some great examples where that's worked over the last year. We need to capitalise on that and build on that there in order to be able to bring our services out into our communities there, dispel some of those myths around vaccinations across the whole year there to enable that. And also in terms of some of the national processes in terms of digital, how we use digital to help us focus in on those communities so we know who to go and help support and target there with our communities and with our healthcare. Primary care, general practice, our community pharmacists have done a fantastic job in order to be able to deliver some of our vaccines there. You can see from the stats on there that we kind of nearly hit 750,000 people last year in terms of our flu campaign there. Our spring COVID campaign, we achieved over 150,000 vaccinations there. So lots of challenges, yes. The opportunities are there and the successes have definitely been there, but we need to capitalise and build on that. Thank you, Chair.
Thank you, Nadja. So I will try and keep this brief. As Rob said, thank you. As Rob said, one of the things that's contained in the annual report and accounts is to demonstrate how we spend our £6.1 billion in a way that's wise and in line with our objectives, delivers value for money for the taxpayer, and also meets the standards you expect from a public sector organisation. So for 24-25, we had a system plan, and when I say system, that means that the ICB is a statutory organisation, plus the 10 NHS provider trusts in West Yorkshire. We had a system break-even plan, and we broke even as a system at the end of the year. So in that regard, we delivered our plan. For people who've spotted the sort of detail in the accounts and on this slide, as an ICB, we did set off the year with a plan to deliver a £21.4 million surplus with an equal and opposite deficit in NHS providers. There was some variation against that plan, and that was driven by a non-recurrent cash transfer that the ICB board supported at the end of the year, which allowed that cash resource to be passed to NHS providers, which was a positive thing. In terms of our financial duties, we've got 3 as an ICB. One, to make sure that we live within the resources that we're set by NHS England, both for revenue and for capital, and a specific requirement around not spending more than we were allocated for our running costs, and we met all 3 of those requirements. We also have some guidance around paying suppliers on time, called the Public Sector Payment Policy, and on all 4 measures we exceeded the target. So the other key thing that's contained in the annual report and accounts are the views from our external auditors and our internal auditors, and I'm pleased to report that again in 24-25 we had an unqualified external audit opinion, or a clean external audit opinion, on our accounts. We also received a positive value for money opinion, and the assessment made by our internal auditors was that we have effective systems and controls in place, which again are all helpful in terms of making sure that we have adequate operations and controls in place. And then the very final slide just sets out in a little bit more detail about where our 6.1 billion goes, and you can see there the sectors and the range of services that we commission on behalf of our population.
Thank you all. Thank you very much for that. The board is asked to note the annual report and the accounts. We did invite questions from the public on the annual report and the accounts, and we haven't received any. But in the public meeting that directly follows this meeting, there are some questions which we will be addressing. So I now call the AGM to a close, and thank you all for your attendance and your participation.